Welcome to Chad's webinar that focuses on using cultural humility to engage Black families of children with ADHD. Today, I'll be your presenter, and I am Joy Banks. I'm a professor at George Mason University, and I teach in the Division of Special Education and Disability Research. I've taught courses that focus on race and disability and reading development and transition to college. Most recent presentations and publications address the unique intersection of race and disability and ways in which children and families navigate schools and communities. And before becoming a university professor, I was also a high school teacher. And I work with students who are in cross-categorical classrooms, inclusive classrooms. This presentation provides a pragmatic illustration of how teachers can build partnerships with Black families of children diagnosed with ADHD. In this presentation, you'll find actionable steps to improve collaboration with culturally and linguistically diverse families of children with ADHD. Some of the outcomes for us today include identifying trends in ADHD diagnosis over the years, understand the importance of culture in educational settings, identify and define cultural humility and ways it can be used to increase engagement with racially diverse families. And toward the end, we'll identify 6 steps to co-facilitate discussions about ADHD diagnosis and treatment with racially diverse family members. We know that there has been an increase in the number of children diagnosed with ADHD over the years. According to the National Survey for Children's Health, the prevalence of ADHD across the United States varies from about 2.3% to 13.6% in children between the ages of 13 and 17 years old. We also know that there's a considerable range between the highest and lowest prevalence rates across different regional areas. Most children labeled with ADHD are between the ages of 12 and 17. And we find the fewest children identified with ADHD between the ages of 2 and 5. Using the same data source, we can see that there's a few discrepancies across racial backgrounds. Further, we also see that Black children are more likely to be diagnosed with ADHD than their Asian counterparts. And we also know that males are more than twice as likely as females to receive ADHD diagnosis. Researchers have suggested that teacher or assessment bias could have an impact on the disability categories that are more subjective, which leads to racial disparities and the overrepresentation of students of color in special education. Historical trends indicate that factors such as gender, race, ethnicity, and even socioeconomic status are significantly related to whether or not a student is identified with ADHD. When we begin unpacking discrepancies and the characteristics of ADHD, variations in prevalence rates across cultures may result from teachers' differential tolerance for behaviors that are outside of their own cultural norms. So teachers may misinterpret a student's behavior, particularly if that teacher is unfamiliar with the student's culture. What we know is that Asian students are less likely than non-Asian American students to receive a diagnosis of depression and more likely to receive a diagnosis of anxiety and adjustment disorders. Girls who are Latin and living in a home where English is a second language are less likely to receive services for ADHD. Externalizing behaviors increases the likelihood of a diagnosis of ADHD for Black children. These discrepancies in identification and in identifying the characteristics of ADHD, lets us know that educators have to become more knowledgeable about language differences and cultural differences and how those differences impact the academic and behavioral outcomes of children from racially and linguistically diverse backgrounds. Unfortunately, limited understanding of cultural differences may cause professionals to project dominant views of behavior on children. And indeed, we have to encourage professionals to adopt a framework of cultural humility in order to become more empowered to work towards equitable outcomes for students from diverse backgrounds. So, what we'll do is take a look at this definition of culture, and then we'll take a look at how culture impacts parents' response to diagnosis and treatment. Culture is the aggregate of beliefs, attitudes, habits, values, and practices that form our reality. These patterns serve as filters through which a person or a group views and responds to their environment. Many families from culturally diverse backgrounds have been historically excluded from the school context, and families may experience marginalization due to their racial identities, their language differences, physical or cognitive differences, even immigrant status. Our ability to engage in courageous conversations about cultural differences increases trustworthiness among historically marginalized and economically diverse learners. Also, creating an atmosphere of trust requires educators to actively resist negative cultural narratives about racially diverse students. Using culturally responsive pedagogies can help to eliminate some of the barriers that are experienced between teachers and racially diverse families. So as we think about culture, we also have to unpack this idea of culture. What we see is that there are 3 levels of culture. Each level of culture has an impact on our ability as educators to build trust with diverse families. That very first level that you see is the surface level, which includes observable and concrete elements of who we are, and it has a low emotional impact on trust. The surface level of culture often refers to our overt or visual cultural artifacts, such as dress or hairstyle. Then there's shallow. Shallow level of culture is the unspoken rules around everyday interactions and norms. The shallow level of culture refers to the values that guide our public behavior. And then there's the deep level of culture. The deep level of culture is the implicit knowledge and unconscious assumptions that govern our worldview. The deep level of culture may also inform our own personal biases. These 3 levels of culture have implications for how we view ourselves and how others view us. Our culture gives us a framework for how the world works, or at least how we think the world should work. So when we're talking about personal implications of culture, we can see how it impacts our own sense of belonging and also how others view us. We can see how personal implications of culture impact our sense of identity, our sense of community, and whether or not we consider ourselves an insider or an outsider to the culture. There are also societal implications for culture. These societal implications impact where we live, may even impact health disparities or our access to health care. It impacts how we're treated and even how we treat others. It impacts our power and prestige in relationships to others. And it may even impact our access to affordable housing. One promising approach to enhance collaboration with culturally diverse families is the idea of culturally responsive education. Culturally responsive and sustaining pedagogies provides a framework for understanding the relationship between teachers and racially diverse families. Teachers can use culturally responsive pedagogy to validate and empower ethnically diverse students by promoting their cultural histories, their individual abilities, academic success, and social political consciousness. When we look at culturally responsive pedagogy, there are three definitions that we have. And we can see that that first one encourages us to focus on using cultural references to impart knowledge, skills, and attitudes. That second definition talks about using the cultural knowledge, prior experiences, frames of reference to make learning encounters more relevant to students. And then finally, this last definition talks about the ability to recognize students' cultural displays of learning and meaning making, and to respond positively and constructively with teaching strategies that use cultural knowledge as a scaffold to connect the student to new concepts and content in order to promote effective information processing. So, what I'd like you to do now is take a moment to think about these three levels of culture and also how culture impacts us personally and in the larger society. So, take a moment to think about why is it necessary to identify your three levels of culture when meeting the needs of students in your schools. Also, think about what are some strategies you use to relate to each level of the student's culture in your school? And we'll give you a moment here just to reflect on that and maybe write down a couple ideas. So, to summarize, when we think about culture, culture is a set of values, beliefs, and practices within the community. Culture is not simply the race, ethnicity, language, preferences, economic status, or national origin of the individual. Culture is an interaction between an individual and group factors within that context. So, what we'll do now is take a look at how culture influences parents' access and response to ADHD treatment and diagnosis. Researchers show us that culture and racial background of the parent influences their willingness to engage in help-seeking behaviors. Parents' racial backgrounds also influence their preference for treatment for their children. According to the CDC, approximately 3 in 4 children diagnosed with ADHD receive treatment for their symptoms, including medication and behavioral therapy. Although ADHD symptoms can continue through adulthood, data for treatment is often centered around individuals under the age of 18. So it's important that educators develop an understanding of how families interpret and experience the diagnosis procedures, and as well as their access and willingness to accept treatment. So this particular table provides us with some insight into parents' preferences for treatment and provides us with insight about differences related to parents' ethnic background. What we do know is that approximately 82% of children with ADHD receive either medication or other mental health treatment. And when deciding the type of treatment, a survey was conducted to explore parents' beliefs. And the survey found that parents' understanding of and belief of causes of ADHD are the most influential in deciding the types of treatment parents seek for their children. Studies have also found that family members' understanding of ADHD will impact their health-seeking behaviors. However, acknowledge that racism, bias, and discrimination or social stigma around mental health also influences parents' decisions to seek out treatment or to seek help from medical professionals or even educators. When we take a look at this particular table, what's most interesting is what we find in the fourth column. What we see in this fourth column is that more parents from ethnically diverse backgrounds chose the treatment option of none of the above than did parents from the dominant cultural background. This may be an indication that parents from culturally and linguistically diverse backgrounds are slightly more apprehensive about the diagnosis and even treatment options for their children who are identified with and even without ADHD. Given that there is a difference in how parents respond to treatment options for children with ADHD, it's again even more important that teachers are flexible when offering various treatment options, and that teachers are also flexible in understanding how parents might respond to a diagnosis of ADHD. So in the next couple of slides, we'll move forward with understanding what it means to be a culturally competent professional, and then we'll also move forward with understanding what it means to practice cultural humility. So during the next 3 slides, you'll have 5 different descriptions. Each description provides a level of cultural competence. What I'd like for you to do is simply read each level of cultural competence and then identify your own level of cultural competence. You don't have to share that response with anyone. This is just an opportunity for you to become self-aware. Okay, so cultural competence is loosely defined as the ability to understand, appreciate, and interact with people from cultures and belief systems that are different from our own. This very first level of cultural competence is described as culturally destructive. The definition is you hold a limited view of appropriate behavior. You may project superiority by stating with authority and conviction that your culture is the best and expressing directly that students should adopt Western middle-class behaviors and dress. At the same time, you may filter interactions through a biased lens without engaging in self-reflection or examination of the impact of your prejudice. For level two is called cultural incapacity. The definition is you ignore the relevance of diversity while using the dominant population and our culture as the expected ways for behavior and school engagement. You are aware of the need for system-wide transformation, but believe that you are powerless over circumstances or organizational systems. And just as a reminder, we have the second slide that will provide us with 2 more levels of cultural competence, and then the next slide will be the 5th level of cultural competence. For level 3, cultural blindness, you uphold the belief that there are no essential differences among individuals across cultural groups, that everyone experiences discrimination and is subject to the biases of others. You believe that approaching all students and families as individuals negates the need to focus specifically on diversity. Level 4 is pre-competence. You acknowledge a need for more guidance specific to the populations you serve. You acknowledge the need for your school to develop support services to meet the needs of students based on ethnicity, race, culture, and language. but you may lack the information necessary to translate your recognition into practice. Even so, you and your school have taken steps to improve your knowledge of diversity. In level 5 of cultural competence, level 5 of cultural competence is considered the highest level of cultural competence. And level 5 is cultural competence and proficiency. You acknowledge differences across and within races, ethnicities, and cultural groups, and you know that these differences need to be integrated into all phases of behavioral supports and family engagement. At this stage, you and your school are committed to an ongoing process of learning about diverse groups, cultures, and languages. So again, pause here and think about those 5 levels of cultural competence and how you might rate your own cultural competence. Regardless of your level of cultural competence, practicing cultural humility can help us to develop more cultural competence. So here are a couple tips for engaging in cultural humility. Acknowledge the limits of your own knowledge and acknowledge the limits of your own experiences and think about how you might begin to interact with diverse families and diverse children by learning more about their cultures. Remain open to the knowledge and perspectives of others. And then you can embrace every new encounter as an opportunity to reflect on and improve your work. Actively challenge and dismantle power imbalances that create injustice. Practice partnerships in the community. Self-evaluate and self-critique. Refrain from viewing your own cultural values as more meaningful than those of others. And then learn and reflect in a continual feedback loop. And positively engage in ongoing conversations with others who are different than yourself. So when we think about cultural humility, it's also important to define cultural humility and to think about why we're using cultural competence and cultural humility side by side. So cultural humility is rooted in the field of the medical and professional health practices. And it was developed in response to cultural competence. The idea is that it's not simply enough to learn about culturally diverse people or experiences. Instead, there has to also be the practice of engaging in cultural humility, where we actually disrupt this idea that one culture is better than another, or that one way of behaving is better than another. So cultural humility is defined as a lifelong commitment to self-evaluation and self-critique. And that self-evaluation and self-critique is used to actually disrupt power imbalances that may occur between two people from different cultural backgrounds. The core values of cultural humility are an openness to interacting with culturally diverse individuals, a self-awareness and an understanding of one's own implicit biases, values, and beliefs, a process of mutual and respectful dialogue and information seeking, lifelong process of self-reflection and critique, and then becoming committed to amending those power imbalances that we often find in the educational setting or even in the mental health profession. So cultural competence and cultural humility can be thought of as a two-step process. First, you have to understand yourself. You have to understand what your own values and beliefs and practices are. And then you have to be willing to recognize your own prejudices and even cultural misperceptions of others. Then you can connect cultural competence to the practice of cultural humility. When engaging in cultural humility, we engage in, once again, continuous self critique. We challenge power differentials in working relationships and even in organizations. And we develop an attitude of not knowing, but of learning from students and families. And we adopt the mindset of being a lifelong learner with a commitment to learning about diverse students and communities. So now moving forward, we recognize that culture does impact how we perceive behaviors and even how we interact with others. We also realize that because of these experiences of racism, discrimination, and stigma related to mental health, that there are oftentimes that parents of children with ADHD may not seek treatment for their child, and they may also be very skeptical of even a diagnosis of ADHD. So we have to ask, what can teachers do? Teachers can move forward by including culturally responsive pedagogy into the classroom and also into the process of diagnosing students with ADHD. This means identifying strategies and practices that are culturally responsive and that can inform planning and even the curriculum. So, what we see here are just some examples of how teachers have changed or adapted some of the strategies that they use with culturally and linguistically diverse parents. So, what can teachers do? Teachers can think about how to adapt current instruction in order to meet the cultural backgrounds of the students that they teach. In this particular study, we see that teachers were able to change instructional strategies in three different ways. They were able to make global adaptations, they were able to make cultural adaptations, and then they also identified practical barriers that may have caused families to become more apprehensive about engaging in problem-solving strategies for students who were exhibiting challenging behaviors. So in that global adaptation process, teachers used the existing strategy of a behavior intervention and taught parents how to use that same behavior intervention, but provided concrete examples and even in some cases changed the type of language that was being used so that the language did not use professional jargon, but used language that was appropriate for a parent that may be less familiar with the schools, with that may be less familiar with educational jargon. Cultural adaptation. In this area of cultural adaptation, it was important for teachers actually to change the language that they use to describe the student's behavior. As an example, when we're talking about challenging behavior, it's often the case that a teacher might use the term problem. Well, of course, using that term causes parents to become even more apprehensive about how the teacher is judging or evaluating their child. So, in the cultural adaptation, teachers were encouraged to use terminology that was more affirming and that was more supportive and in alignment with the family's cultural beliefs whenever possible. And practical barriers, some of the practical barriers, again, related to the language that teachers often use, such as saying that there would be behavioral therapy. In this particular case, it was important for the teachers to refrain from using the term therapy and also just think about how they might reframe the supports for students by saying that there were simply 8 classes in a program that was used to support the student. What we also know is that no one treatment was found to be a cure-all. Teachers have to be willing to provide parents with multiple options about treatment, and know that parents may also make recommendations on their own about what treatments they see as most appropriate for the student. So there are 6 steps to culturally responsive discussions. On this slide, those 6 steps include the following. The first step is to inform family members about the characteristics of ADHD. Ensure that communities have accurate information about ADHD etiology and also treatment. Step number 2 is to facilitate conversations with parents and those who support the parents. Involve social networks and extended family to be a part of those conversations. Offer multiple options for treatment and reframe problems as opportunities to support the student. And then strategize. Strategize to co-create strategies, communication mechanisms, and responses to the behavior. And then, of course, this last step is to ensure that you value the perspective of the educators and the family members. Make sure that you treat educator and family concerns, ideas, and questions as being equally as important. And think of it this way: that educator is bringing in information about the school setting, and that educator is the expert as it relates to instructional implementation. That parent is the expert related to their child. They know about their children, and they can bring insight that educators may not know on their own. So it's important to frame the diagnosis and treatment of ADHD through a culturally responsive lens. And there are a few steps here to keep in mind and to consider. And that first one is to acknowledge disparities in access to mental health care. That is, to think about the community in which your school is located or even in which you serve students with disabilities. Acknowledge that bias, discrimination, and stigma around ADHD, race, and disability exist, and that it will influence parents' response to a diagnosis and to treatment. There may be competing concerns and levels of social support. Recognize that families are getting information from school settings as well as from other members of the community. Sometimes those pieces of information may be aligned, and in other cases, they may not be. Acknowledge that there are differing cultural beliefs and perspectives around ADHD. Acknowledge levels of understanding around ADHD symptoms and treatment. And then educators and parents' relationships and engagement to treatment are important. It is important for educators and families to build reciprocal relationships in order to ensure that the child is receiving the supports that they need. So thank you for your time, and hopefully you will be able to be a more culturally competent educator, and hopefully you will be able to engage in cultural humility as you serve children and families who are experiencing the diagnosis of ADHD in your school and in your community. Thank you.